class is the first of 4 classes in a workshop for back problems, back pain. So today's class we're focusing on the long muscles of the back. If you have ongoing, persistent low backache, sometimes it will be diagnosed as disc problems, spinal problems, kidney problems, urinary tract infections. There's a whole load of things that it might get diagnosed as, but there's always a possibility that it's none of those things and it's trigger points, active trigger points in the back. So it's safe to do, it's easy to do, and it's just a really good thing to try, as an elimination. If you do this class or the other 3 classes and any of those make you feel better, then you know that you're dealing with myofascial issues and not necessarily wear and tear. So the long back muscles, I'm not sure if you're on the computer, you could probably look at that picture and you could probably zoom in, but you've got three layers of long back muscles. You've got your multifidei, your rotators and your spinalis muscles, which are all very close to the spine, and they run from the skull right the way down to the tailbone. Then the next band of muscles that's a little bit further out is your longissimus muscles. They're called longissimus because they're the long group of muscles, and they go from the skull right the way down to the tailbone and the sacrum. And then the outer layer from that is your iliopostalis, and they sort of run from the lowest of your cervical vertebra and down towards the curve at the back of your pelvis. So where the ilium is at the back of the pelvis, they connect to that curve. Quite often that one is felt from the shoulder blade, just underneath the shoulder blade, right down into you'll feel it even into the butt, through the myofascial system. So the glute muscles are one of the 3 classes. Through the fascial system, the back muscles seamlessly go into the glutes, and the glutes will absorb stress in the back. And always something to look at if you've got back problems is to look at your glutes as well. So today's class we're doing the long muscles, so I'll get rid of that picture. If you're not sure, you could go online and you could look up those 3 named groups of muscles. You get a nice picture somewhere of where they are, what they look like, and then that gives you a better picture in your mind of what you're dealing with. So I'm going to do the class in real time today, so I'll do it with you so that you can stream it through the TV and you can do it along with me. Now, when you're doing myofascial work, there's a whole range of things you could use. So everything from a really hard trigger point ball, that is something that you would work up to because it can be quite challenging. Then I use these a lot, which are like super balls. They're pretty firm, but they've got quite a bit of give in them, so I love those. And you really want pairs of balls if you can. You want 2s of the same size and the same firmness. And then these are probably my most popular ones, which are just really soft, cheap ones that you can get from the dollar shops, from the cheap shops. And they're hollow, they're skin textured, which is also important when you're doing some of your myofascial work. You want something that's got the texture of skin, and that's really nice to work with. So these are probably my favorite ones that I used in the studio. And then if you wanted to go, so you need these for trigger point because they're going to press on the nerve, and they're going to cut off the blood supply to the nerve, and that will help the reflex that's blocked and locked up to release. But if you wanted to go for massage, then you can go for these hedgehogs, which are spiky, they're nice and stimulating. So they're not going to give you the direct pressure, but if you've got a lot of pain, if it's very acute, you might prefer to try something like this to begin with, just because it's less confronting. Bring the pain down from a 10 to a 7, and then you could start to use the other balls. So hedgehogs are quite a good way to go. And then in terms of equipment, this is a really good thing to have, is a half roller. And I was fine with these. If you're a bit short of money, you could buy a full length one, cut it in half, sell the other half to someone else, and you've got yourself a very, very cheap half roller that you'll use a lot. They're really good for necks, they're really good for lumbar spines, good for everything. And if you're not very coordinated and rolling is a little bit, you know, too much for your neck, your shoulders, your hips, whatever, then a half roller is a really good way to go because it's easier to control. And then eventually you progress to the full roller. The full rollers are great, so they're very versatile. They're, you know, if you get them, I can get them cheaply, I'm not sure if you can. Go for the foam ones rather than the, you know, the rubber ones rather than the foam ones, because the foam ones are quite a bit harder. And usually the rubber ones are a little bit better quality. The foam ones will flatten down over time. These can be a little bit too big for necks and lumbar spines. So ideally, you've got the half roller and you've got the full roller. So that's the sort of equipment. If you haven't got the money for that, or you just haven't got one and haven't got time to get one, get a bath towel and roll it up really firmly. And it's a nice, kind, softer option, and it does a really good job as well. So this, you know, when you're doing myofascial work, there's always something that you can grab from the house that's you can adapt to use that's going to be a good option. So we're going to start with Multifidei, the Rotators, and Spinalis, which are all the muscles that go from the skull right the way down the spine, right the way into the sacrum and the tailbone. And you could go anywhere down the spine and you would hit trigger points, but we're going to look for the master triggers. So the master trigger for the Multifidei is if you come to your spine, if you just put one hand over your shoulder, if you lift your arm up, you can feel the top of your shoulder blade. And then you'll go down a bit, you'll feel there's a spine, a ridge that runs across. And then you feel the inner edge of your shoulder blade. Where the top of the shoulder blade is, so you lift your arm up to find the top of the shoulder blade, that's about level with T1, T2. You're going to come down to the middle of your shoulder blade, and you're going to be right on the spine. So you've got the spine and you're right, you know, just off to the side slightly, but you're on the vertebra. So I suggest you choose your soft balls. So you're in the middle of the shoulder blade, right up against the spine. And then the next one is T11. So T stands for thoracic. So if you take your hand to the back of the rib cage, you feel the lowest rib, that's T12, and it attaches, the ribs attached to the vertebra in the spine. So you want to come up one rib from the bottom of your rib cage on that same side. So we'll say the right side. So the middle of the shoulder blade, up against the spine, one rib up against the spine. And then the third ball, so you need to choose another ball, is if you put your hand at the back of your pelvis, you can feel the curve of the pelvis, and you can feel it goes down a little bit. And where it goes down, that's called your PSIS. And that's sort of where the SI joint is, the sacroiliac joint. So the PSIS is a really important place. There's lots of activity there. You've got glute muscles, you've got spinal muscles, you've got fascia in there, and you've also got the movement of your sacroiliac joint. So those three places, middle of the shoulder blade, one rib up, and then down on the PSIS, where you feel that little drop down of your pelvis into the line that goes into the where the sacrum is and where the joint is. So you've got your sacrum, and then you've got the bone of the pelvis that butts up against it. So really, when you do this, you're looking for anything that's tender. So these are just rough ballpark places to try, but you could try up or down from those places. And if you find a place that feels exquisitely painful or uncomfortable, then you're on a trigger point. If you feel a pulse, you're not going to feel one in this place, but if you feel a pulse, you're in the wrong place. You never do it on a pulse. If it feels a little bit fizzy, it could be you're on a nerve and you just slightly move off to one side. So I'm going to use my rolled up towel as a pillow for comfort, and we're just going to find the middle of the shoulder blade, but right up against the spine. You're going to take the next ball, one rib up, and then the third ball right into the back of the pelvis where it comes down. So it's usually, this one is about 2 fingers out from the spine. So you're just going to lie into those balls. So maybe with your other hand, put your other hand under your bottom so you don't feel like you're wobbling all the time with the balls on one side. Start with the knees together and just gently roll the knees. Just sway the knees and just see how that feels. Take some deep breaths. So when you're doing myofascial work, when you're doing trigger point work, you're really looking to be about a 6 out of 10 in discomfort. If it's more than that, ease up a little bit. So the knee roll is a sort of roll onto the ball, roll off the ball. You could just stay on the balls and then just measure how, how high you are in that scale of 10. So if it's super high, take some deep breaths, maybe move the balls off slightly. You don't want to feel nauseous. You don't want to feel your muscles are tightening and constricting and that you're going into pain and defense. Some people have got very high pain thresholds. Some people have got very low. So you've just got to determine what your 6 to 7 is in the scale of 10 and just stay there. And then you'd stay here for about 90 seconds, 2 minutes maybe. If you wanted to go a bit stronger, you could take the feet a little bit wider. You could add a bigger knee roll. You can move your nose because of the connection right up to the neck. So the master triggers talk to the satellite triggers that are all around them. And if you can find your master triggers, then those satellites, some of them will turn off. So that speeds up the process. And sometimes when you're on your master trigger, you get a picture in your brain of where the pain is going through the body. So you might feel a whole pathway of pain. And that is a good thing because it's really confirming that you found a master. And what will happen is after about 60 seconds, if you start to press into those balls even more firmly, you'll go back up in pain, but then you should start to feel that it's subsiding fairly quickly. If it's not subsiding, then maybe you would just leave that trigger and you'd come back to it again later in the day and just gradually bring it down. So it depends how bad it is. You don't want to make yourself feel really uncomfortable while you're doing it. Sometimes you can do it in one go. Sometimes it might take 4 or 5 goes before you bring it down. It will come down from a 10 to a 7 to a 5 to a 3, and then it's gone. And once it's gone, it should stay as a permanent change unless you do the habitual thing that caused it again, and then it could come back. So if it's an ongoing pattern, say you're a lorry driver or something, and you're always sitting in a certain position, then you're going to do this as a maintenance plan rather than a total cure. But oftentimes trigger points can miraculously turn people around. They suddenly realize they didn't have a disc problem. It was actually just the trigger points in the back were chronically locked up. So that's about 90 seconds, 2 minutes. So just take a minute to think about where those balls are, and then we'll take them over to the other side. So right up against the spine on the PSIS, where the curve of the pelvis comes down into the SI joint. And then the next one is one rib up against just off center on the spine. And then the next one is in the middle of the shoulder blades, right up against the spine. Oopsie. So you have to move them around a bit until you get them into position. Now for me, straight away, I can feel that this side is the side for me that has the problems, because this side was okay, this side is challenging. So I'm already about a 7 or an 8 on this side. So you go back to knees together and you just do your gentle knee sway. Take some nice deep breaths. You're thinking relaxing thoughts, you're thinking positive words. So part of the brain is called the hypothalamus, and it interfaces between the body and the brain. So if you're thinking negative thoughts, it's going to send messages to the body that you're in danger, that you need to stop what you're doing. The pain will seem to get worse. So the best way to counter that is to use your thinking, use your mind to say nice things, good things, focus on the breath. Especially if you're on a challenging side, you'll notice that your body is almost going into defense. So you've got to focus on deep breathing. So breathing is one of the most important ways to bring your body into a calm state, to switch from flight and fight back into your parasympathetic nervous system, which is relax, digest and heal. So it's slightly coming down, but it's still pretty acute. So what I'm going to do now is I'm going to press into those balls, and it's gone way back up there now in pain. And take some nice deep breaths and think some nice positive words, and it's already starting to come down. So these are your deep spinal muscles. So this is the first layer, which is close to the spine. So multifidei connect all the little processes of your spine together, and spinalis all very close to the spine. The rotators. Okay, so take those balls out for a minute. Just give yourself a moment and see how you feel. So the next band, which is about 2 fingers out from the spine, is longissimus. And the master triggers for longissimus, I always have to check this because they're all so very similar, is T5, so same place on the right side. So in the middle of your shoulder blade, but coming out about 2 fingers. So you're between the inner edge of your shoulder blade and the spine, right in the middle. So that's always an interesting place to go to. And then T10. So T10 is 2 ribs up, in line with that upper ball. So again, you're about 2 fingers out from the spine in that big ridge of muscle that goes down the back. And then the other ball, you're going to go to the other side, and you're going to go to the lowest rib, so T12, and about 2 fingers out from the spine. So just see how that feels. Bring your knees together, just do a little gentle rock. So this one that's on the other side of the body, you could be on the 12th rib, or you could come slightly under the 12th rib into what is level with L1, lumbar spine 1. And find which one seems to be the right one. If you don't feel very much at the rib, T12, come down a bit. I think for me, it needs to be on T12. So you can do little knee sways, you can take the feet into wider. Once you come below the ribs, you can also do little pelvic tucks. So that's stretching the long back muscles, but it's also pressing you into the ball or balls. So longissimus runs all the way from the neck, from the skull, right the way down into the bottom of your pelvis. You can move your nose. Take some nice deep breaths. Think, relaxing thought. And in this position, if you wanted to, you could also do a little bit of the knee lift. It's up to you. I think I prefer the pelvic tucks. It's just a little bit more direct. Sometimes when it's quite challenging, you feel a little bit nauseous maybe. That's a sign that you're getting into too much confrontation. Just focus on the breathing. Try to breathe in through the nose, out through the nose. It's a far better way to breathe. Try breathing in for 5, breathing out for 5. Breathing in, breathing out. So using that pattern of breathing into the nose for 5, out through the nose for 5, will quickly bring you into a much more relaxed state. Sometimes when we do that sort of breathing, you breathe in for 5, you hold your breath, and then you breathe out. So just give yourself a moment between the inhalation and the exhalation. And what I'm noticing now is it's suddenly gone from perfectly fine to actually, I can feel the tenderness in the muscles. So that means the muscles have gone from very tight
to starting to relax and yield, and now you're getting in there. So that's a good sign as well. So I can feel that T11 on this side is a little bit unhappy. I can also feel the pathway right up through to the back of the neck. And then you could just try pressing into those balls a little bit more. Should feel like it's gone worse, but then quickly subsides. And if it doesn't subside, just give it 20 seconds and then leave it and go back to it later on. Okay, so think about where the balls are. So we've got the ball on the other side is at T12, the lowest rib, or maybe you come down just a fraction just under the rib. And then the other one is at T11, about 2 fingers out, so one second rib up from the bottom. And then the first one really is the one that's in the middle of the shoulder blade, but it's about 2 fingers out from the spine. So this side again is like way up there, not such a nice, happy feeling. And bring my knees together. So I'd put myself at a 7 or an 8. Make sure when you've got the pillow that your head is not being pushed forward, that your neck is comfortable. Focus on your breathing. You could separate the feet to hip space and do your pelvic tucks again. Watch what you're thinking. Make sure you're not thinking about other things. You want to be present in the moment, and make sure you're not thinking negative thoughts. So the brain listens to your self-talk, and then the hypothalamus will translate that to the body on so many levels, not just in the trigger point work, but also in every day. So we can store a lot of stress and a lot of tension in the body, in the muscles, in the nervous system, but mostly in our fascial system. The fascial system is the place where we have stored stress. So we did the knee lifts as well, if you want to try that. So when you do trigger point work, you're trying to discern between 3 different sorts of pain. You've got pain that's stored in the body from something in the past. You've got pain that you're pushing into the body, and then you've got pain that's leaving the body. So when you're doing your myofascial work, you should feel that although it's painful, the pain is leaving. You're not storing up pain in the body, you're not putting pain into the body, it's actually leaving. So that's where you have to discern, you know, is this too much for me? Do I need to go into the surrounding area around the trigger and just gradually bring everything down? Or am I able to go straight to that trigger point and work directly? So these are questions that you have to ask yourself. So just pressing into those balls now firmly. And it jumped up, but for me, it's immediately it's coming down, and that's always a really great sign. So when you're doing trigger point work, it's called ischemic pressure. You're pressing on the nerve, you're cutting off the blood supply to where the nerve comes into the muscle, and then that just switches off that holding pattern, that reflex where the nerve has gotten locked up and the muscle around it has become blocked and congested. So it sounds like a bad thing, but it's on such a minute scale, it's not going to do any harm. And then you just relax. So just take those balls away for a minute. Give yourself a moment to assess and just see how that feels. So now the next one is Iliopostalis, and this one goes from the lower part of the neck down to the crest of the back of your pelvis. And the trigger points for this are T6, which is a little bit lower to where we were in the shoulder blade. And then you're going to go, so middle of the shoulder blade, come down one rib, and this time you're right up against the inner edge of your shoulder blade. So you're about 2 or 3 inches out from your spine. So it's the band that comes on the furthest out from the body, from the spine. So the next ball wants to be at T11. So in line with this top ball, you're going to go up 1 rib, T11, and then the other ball is going to go 2 to 3 inches out from the spine on the other side of the body, but in between the rib cage and the pelvis. So this muscle group on this other side is called Quadratus Lumborum. So just see how that feels. Now for me, this line is always a line that's very active for me. I quite often get pain under my shoulder blade that goes right down towards my sit bone on this side. So this is your Iliopostal group of muscles. So start with your knees together and just gently sway. So it's painful for me, but it's a sort of delicious sort of painful, because I know that as I'm pressing on this line, it's just letting go. It's going, it's going, it's going. So take a nice deep breath, think good, positive thoughts. Maybe the nose moves with the knees, that's up to you. So if you feel it up towards the neck, add the head as well. You can take the feet into wider. So it's very uncomfortable when you've got muscles in spasm, you're in constant low-grade pain. It's very debilitating. It can make you feel quite depressed. You don't know what to do to get away from it. So this sort of thing, you know, at the end of a long day, just lying on the balls is going to really make a huge difference. You're going to sleep better. The muscles are going to relax more. Just do some pelvic tucks. So think about the lines. The first line of the multifidei was the spine. You could do anywhere from the skull to the tailbone. The second middle band of muscles is your longissimus muscles. So again, anywhere down the neck on that middle band, right the way down towards your sacrum. You could get 3 or 4 or 5 balls even, and you could just lie on them. You could do both sides at the same time, but I find that sometimes, especially when you're in pain, that it's too much information to the brain, and you can get overloaded by the sensory feedback. So I prefer to do one side and then do the other side, so that I can really focus on what I'm feeling and not get overwhelmed with some of that discomfort that's coming into the brain. So you can also do a knee lift here. So as you lift your knee, you're going to push into those balls quite a bit more. You find over the months, if you do this, that you can actually start to progress to some of those harder trigger point balls. Your tolerance will increase and your pain will come down. So as that happens, you can go harder. You get to really enjoy doing this. And you'll find that you'll need to do it for less and less times. Maybe in the beginning, you're doing it every day until you resolve the issue. And then maybe it goes to once a week, once a month, once every 2 or 3 months. So you don't have to do this all the time. If you get this right, you get instant changes and permanent changes. So think about where the balls are and just switch them over. So you've got the one ball on the other side comes into the gap between the ribs and the pelvis, about 2 to 3 inches out from the spine, in the flesh, in the muscle there. And then you're going to take the other ball over and you're going to put it in the middle of your shoulder blade, right up against the inner edge of your shoulder blade, but then come down one rib. And then the middle ball is going to be one rib up in line with the top ball, so about 3 inches out from the spine. So just move those balls around, find where you can feel. So here, again, I can feel that whole side. It's never a straightforward thing with back issues. If you've got pain on one side, sometimes it's reacting to something that's going on the other side. Maybe you've got hip issue or leg length discrepancy or SI joint dysfunction. There's a whole load of things that it could be. So you always look at the whole body and just really focus on what the feedback is coming into your brain and try to become your own expert. You're the person who owns this body. You know this body better than anybody else. So you should become your own expert. You don't need to see doctors and physios, and you can prevent going on into that terrible crisis where you end up, you know, unable to work for 2 or 3 days because your back is gone. You can take control and you can really start to figure out what's going on in your body and take care of it. So pelvic tucks, a little bit more pressure into those balls. Maybe a knee lift. It's noisy here today. We've got everyone's cutting their grass, getting ready, getting their gardens ready for Christmas. So there's pretty a lot of activity going on around. So when you get towards that 60 to 90 seconds mark, just press into those balls. And ideally the pain quickly coming down. And you know that you've done a really good job on releasing those long muscles of the back. So once you've done that, the best way to get up from the floor is just to bring your knees together, roll sideways, come up into sitting. So the next thing we're going to try is we're going to try some thoracic extension. So the thoracic vertebrae are in the rib cage. So you could use your rolled up towel, a nice soft, non-confronting way of approaching it. You could use the half roller for anyone that's got neck issues, spinal issues, not able to really control their movements, not sure about how flexible they are. Really non-flexible people use the towel. The half roller is the next level. And then I'm going to move all the balls away, otherwise they're going to get in the way. If you're okay to, you could go to the roller. So I'm going to do this on the roller. So the roller is for flexible people. If you're not sure, you put the roller in the middle of the shoulder blade. If you know that you're flexible, you can come to the bottom of the shoulder blade. So we always talk about the shoulder blade as it looks like Africa. So you're only going to come to the Cape of Africa if you're sure that you've got a nice flexible thoracic spine. If your thoracic spine is not flexible or you're not sure, then put it right on the bone of the shoulder blade, right in the middle, so that you can control the movement and go for the softer options of the towel or the half roller. So the other thing you need to think about with thoracic extension is you need to take care of your neck. So you're going to hold the back of your skull. You could put the thumbs at the side of the neck and create a little cage for your neck. There's bringing the elbows forward, it creates a cage for your head and neck to be in, but just make sure you're not pulling. Okay, so elbows wide, you're never pulling on the neck. If you feel very vulnerable in your neck, bring your elbows forward. And if you think about while you're doing this, that take an X-ray in your mind of the cervical vertebra from the back of the ears to the top of the shoulders. There's no movement in the vertebra of the neck at all. So you're not bending your head and your neck forward. Everything is staying fixed in that frame that you've created with your arms. And the vertebrae don't move in the neck. They move between the shoulder blades, thoracic, not cervical. Okay? So I don't want any of you to have sore necks after you've done this. If you did, it's because you're pulling on the neck, using those neck muscles when you don't need to at all. So you're going to put the, I'm going to go for underneath the shoulder blades because I know that I'm very flexible here because I do this all the time. The more you do this, the more flexible you will become in this area. My balls will just starting to roll away. So just sit the bottom down, take the hands to the back of the head. You've either got the elbows forward to make that cage or you've got the elbows wide. And we're going to start with an assessment. You're just going to roll across the roller or the towel. And just take some really deep breaths and just assess how difficult does it feel to breathe. Make sure your chin is tucked, your neck muscles are relaxed, you're in a retracted chin. And you probably feel it's quite, you haven't got a great range of movement and that it's quite hard to breathe. That's normal. So maybe you could turn that side to side into a sort of a figure of 8, but make sure the movement's in the rib cage, not in the neck. So this is an assessment, you're taking some deep breaths. And then come into center, keep your chin retracted, tucked, and just breathe in and look at the ceiling. And then breathe out, contract your abs and look through the knees. Unfortunately, thoracic extension is also a really strong ab work. So if you get tired, have a little rest and then do it again. So tuck the chin, you're breathing in, you look at the ceiling, you take a breath, you breathe out, you assess your breath. You're breathing in, you're breathing out. So now do a little half turn and just do a little bit of a scrub on that outer edge of your shoulder blade. So this is teres major, teres minor trigger points here, a little bit into serratus. Take some breaths while you're doing it. And then go across to the other side, scrubbing. So you want to feel that you're rubbing the bone of the shoulder blade into the hardness of your towel. You can feel those abs working. Come back into center. So just go back to swaying from right to left. Take some deep breaths. You'll be getting a little bit easier. Make your figure of 8. You'll notice your abs are getting tired, but that is normal. So then, keeping the head in the frame, you're going to breathe in, look at the ceiling. You're going to breathe out, contract your abs, look through the nose. Breathing in. So you're really working the thoracic vertebra. Breathing in, breathing out, breathing in, breathing out. So just take the hands to the legs for a minute. Just lift the feet. Kick up and come up into sitting. So we've already started to change the thoracic vertebra. So I just want you to feel down the back of your neck, and you'll feel neck vertebra, and then you'll feel a really big vertebra, which is the first of your thoracic vertebra. So you've got small vertebra and then a big bump, which is your thoracic one. Okay, so you never roll onto the neck. The neck is not strong enough to be put force on the roller. So when you're doing any sort of rolling on the spine, you're working below that big bump. Okay, just below it, sort of T1, T2, and you're never going above that point. So that's a really important thing to remember. So we're going to put the roller again at the shoulder blades. And we're going to link the fingers, hands under the head, and we're going to roll very slowly up to where that big bump is and be just below it with the roller. Okay, you can do a little bit of side to side sway. So this is trapezius muscles in the back of the shoulders. Well, they're pretty tight muscles as well, but that's a whole different class. So I want you now to have your feet quite close to your bottom. Lift your bottom up, and you're going to breathe in, breathe out as you roll down, and you're only going to come 3/4 of the way down. You're not coming to those last 3 ribs in the rib cage because they're not very strong. The upper ones are all connected at the front, but these lower ones are floating ribs. So roll to just below the CT junction, the big bump, the big vertebra, and then roll 3/4 of the way down the rib cage. So rolling to your CT junction. So if you've got a towel, you're going to have to just walk yourself up, walk yourself down, and do it that way. It's still going to work really well. So going to your CT junction, and you're going, I'm just going to straighten up a little bit. So try breathing out as you roll down so that the lungs are getting smaller. And then breathe in as you roll back up. Breathing out, good ab work. The legs and the glutes are working. Breathing in as you move up. Breathing out. So you do this about 10 times. There's lots of different ways of working on the thoracic spine, but this is the most basic one. We'll start with this. Some other nice techniques as well. So you're just really massaging the long muscles of your upper back. So you're still working on longissimus and iliopostalis as well. Last one. So bring your bottom to the floor. Bring the roller under the shoulder blades or on the shoulder blade if you feel that you need to. And go back to your assessment. You're going to breathe in. Much easier to breathe now. And breathe out. contract your abs. Make sure there's no movement in the vertebra of your neck. Breathing in, breathing out. Lovely, feels so much freer. Breathing in, so you don't need to do very much to make really big changes. Try side to side. Take some deep breaths. That feels easier. And now I'm going a lot further. Try your figure of 8. Again, much freer. Your breath is easier. So you're also working on serratus, breathing muscles when you do this, and they're going to deeply affect your ability to breathe. You're doing a little scrub at the side of your shoulder blades, teres major, teres minor, subscapularis, a little bit in there as well. There's a whole load of muscles getting benefit from this. And then come through to the other side, scrubbing. Come back into center. Now, if you're not flexible in your neck, in your thoracic spine, you just do a couple more looking at the ceiling. If you are flexible, you might be able to go over, but just be very gentle. Don't think I've got to touch the floor. Just see where you are today. Inhale. It's more the breath than anything. As you breathe in, you're expanding all the joints of your rib cage, breathing in. So I'm not touching the floor, but I'm going quite deep. One more. So great ab work as well. By now you notice that you've been working those abdominal muscles. So to come out of it, you hold the legs, you lift the feet, tuck your chin, you give yourself a little kick. And then when I've done that, I always come forward into flexion and just allow my brain to assess what happened, because it is quite a powerful release. Just take a few breaths here. And slowly coming back up. So we're still going to work on massaging, but now we're going to come to the QL, the muscles that attach the back of the ribs to the back of the pelvis. These can get super reactive when the back is unhappy. So maybe the towel, and you're going to just lie on your side, and you're going to put the towel between the rib cage and the pelvis. Put your other hand on your chest, keep your chin tucked, and just look at the ceiling and roll forward. So when you do anything near the bottom of the rib cage, you've got to be very careful that you don't put too much shear force pressure into the lowest ribs, because they can break if you're too rough with them. They're not connected to each other in the front. They're floating. You've got the floating rib and then the others connect into the bottom of the rib cage. So you've got to be gentle with them. So it's more of an upward roll, looking at the ceiling. That's where you go into those deep muscles that run parallel with the spine. Sorry about all the noise from the lawnmowers. Some days here it's so peaceful, it's perfect, but today, not today. Okay, so you do that about 10 times. If you wanted to go stronger, try the half roll up. Okay, so we'll do the other side. So the half roller is firmer, hand on the chest, look at the ceiling. So you're lining up through the knees and the ankles. Think of rolling your spine as if your whole body was like a log. Try not to be moving in different sections of your body. That's not great for your spine. So when you do myofascial work, you've always got to be careful that you're focusing on what your skeleton is doing, so that you don't do something horrible because you weren't concentrating on what was happening in the spine. So that could be the neck, or it could be the lumbar spine. Okay, keep going. And the other option is the roller. Now with the roller, it's much bigger. It's much more confronting. So you can support the head, and it's much more likely to press on that lower rib. So really it's more looking up at the ceiling and then only rolling halfway to look forward. So if you've got back issues, your Quadratus Lumborum, this group of muscles, is going to get very reactive and it's going to be unhappy. And if you know how to just get your towel out and just do a couple of minutes of rolling in this place, you can really start to relax your back again. So we're coming down into the final part of the spine, which is the sacrum. And you can do this on a roller. I think I'll do it on a half roller. You could do it on a towel. You're going to lie down. You're going to put the roller or the towel under the back of your pelvis. And then you're going to put your thumbs right up underneath the back of your pelvis. And your hands are going to operate as brakes so that you don't roll too far. Lift your knees up one at a time rather than both at the same time like I just did. And you're just going to gently keep your knees together. You're just gently going to move your knees from right to left. So as you do this, you're massaging the muscles and the fascia in the sacral area. So longissimus and your multifidei, they go right the way down to this area. The iliopostal stops at the back of the pelvis. So if you wanted to try iliopostal, you could just come to the back of the pelvis, see if you're tender there. So you might have, there's lots of triggers here because these are the glute triggers as well. But better to come down just sort of a little bit lower. So I'm about 2 fingers down from the back of the pelvis. And so you're doing a little sway. So that's your easy start. And then you could try little mini marching where you just got your knees sort of gliding past each other. Don't make it a big move. That's not really safe for your back. It's just a little tiny marching movement and you're going right to left. It's good ab work. You could come back into center. You could keep the feet together, but let one knee fall out. Let the other knee fall out. Just see how that feels. If that's okay, you could do both knees together. So again, low abs working nicely. You could let your right knee fall to the side and you could just do knee circles. So you're really getting into your sacroiliac joint when you do this. You could support the leg if you need to. And then do the other side. And sways. As you get a little bit more used to this, you could do a straight leg fall out. Make sure you can keep the bones of your pelvis nice and level. Use those hands as brakes so you don't go too low. You could do heel circles on the ceiling. You could hitch your knee to your shoulder and extend into a high position with the toe turned out. Hitch and extend. Really use your abs for this one. Legs are heavy, so you don't want the load on the spine, on the back. You're using your abs. Last one. So we'll try the other side. Let the knee fall out, knee circles. Hopefully you can see that. I'll put the foot on the floor. Knee circles. That's it. So imagine this foot is still lifted. So you can see what's going on, these circles. And then we did a straight leg fall out to the side. Keep the bones of your pelvis perfectly still. A nice adductor stretch there as well, and the abs are working and the glutes. Heel circles on the ceiling. So you're really pulling in below the belly button now. Make sure you're stabilizing. And then we finish with the hitch. Knee to shoulder. Extend the leg into a high position in turn out. Knee to shoulder and extend. So all that is massaging the back of the pelvis into the towel or the roller, as well as working your powerhouse. And take the foot down. So just slide the towel or the roller out. Keep your knees together and just roll over and come up into sitting. So there's a couple of stretches you can do for the long muscles of the back as well. I've lost my little idiot chart here. So the cat stretch, everybody knows the cat stretch. It's a really good back exercise. Hands on the shoulders, knees under hips. You're going to breathe out and you're going to pull your belly up into the spine. The more you breathe out, the deeper the contraction in the abs, the stronger the stretch in your spine. And then you breathe in, you let your belly drop, you look forward and you're just opening through the sit bones. So you're really stretching into the pelvic floor. So you're going into a flex spine, breathing out, into a hyperextended spine. Flexing, breathing out. Breathing in, we'll do one more. Breathing out. Breathing in. The next one that's a nice one to do for the spine is sitting. So maybe you're sitting in a chair rather than cross-legged, which makes it a little bit harder. Cross the hands on the chest. You're going to breathe in and you're going to spiral up and around. Feel like you grow a centimetre taller. And then you breathe out and you come back into relaxed. You're breathing in, you spiral the other way. So you can feel every vertebra in your spine is stretching a little bit. You don't want to feel one part of the spine is stretching a lot. You want to see if you can get the whole spine to stretch. For this one, you're going to be careful if you're a dominant neck person. Your head is going to try and pull you much further than your spine wants to go. If that's the case, keep your nose lined up with your breastbone. You breathe in, you breathe out, you breathe in. So rotation exercises just give all the vertebrae of your spine a nice stretch. The side roll is a little bit more lumbar spine. So you've got your feet on the floor, arms out in line with your shoulders, palms down. Your belly button is sunken into the mat, knees stay together. You're going to breathe in and take the knees over to the right, but only as far as you can keep your opposite shoulder blade down. And then you're going to deepen your abs, pull up through the pelvic floor, up under the ribs, and come back to center. So again, you're going to the other side, keep this opposite shoulder blade down, deepen the abs, come back into center. So think 70% abs to let the knees roll, and then 100% abs to come back into center. Once you can do that comfortably, take the head in opposition to the knees. Make sure both shoulder blades stay down. 70% abs, 100% abs. 70% abs. So your whole spine is getting a really nice counter rotation. If you're okay with that, you could progress to lifted knees, but sometimes it's better to keep the feet on the floor. So you just see how your back feels. Knees right, so start with just the knees, keep the shoulder blades down, 100% abs to come back to center, knees left, 100% abs, and come back to center. Then see if you can take the knees away from the head away from the knees, 100% abs into center. Make sure the shoulder blades are down and you feel really nice in the spine. You should feel good in this. If you don't, you're working too hard. You're never trying to touch the floor, either with the feet down or the feet lifted. It's better to have the weight of the legs really stretching the spine rather than touching the floor. Just hug your knees for a minute. Another really good stretch for your spine is just to come into a very tight ball. You're stretching from the base of the skull right the way to the tailbone. It sort of equalizes the tension throughout the spine so that when you bring your head down, when you take your feet down, your spine is much more relaxed. So I think I've got just one more here. Spine stretch front. So I'm just going to hold behind the knees. So coming up from the floor, chin into tuck. You just swing up into sitting. So there's no real work involved with that. Spine stretch forward. Take the feet to hip space. Put the hands, I'll do it long way so you can see. Put the hands between the knees. So very straight spine, and then you're going to pull back at your mid-thoracic spine to create a curve in the back. Pull up through the pelvic floor, up under the ribs, and just gently walk forward to where it feels good. So that's the important part, is you're not going to pain, you're not going to gripping. Just deepen the belly, walk yourself back in. You don't do this a lot, you do it 3 times. So really long spine. Pull back at your mid-thoracic spine, so you're in a curve. Pull the belly up under the ribs, walking forward. If you pull your toes towards your knees, you're going to get a stronger stretch through the whole of your spine. Deepen the belly, make sure it still feels good. Walk yourself back into center, point the toes. So one more time, straight spine, pull back at the mid-thoracic, pull up under the ribs, pull the toes towards the knees, walking forward, deepen the belly. Walk yourself back, nice and gentle, through the hands. Come back into upright
and you finish. So that was the first class, and just keep doing this until you start to feel, it could be all of the back muscles, but I know for me it's the iliopostalis, the outside ones. So you might find one of those 3 lines of tension through the back is the one that you've got the problem in. You might find certain triggers that are very active, and if you can figure that out, then you become your own best expert. So look for the next one and see if there's more answers for you in that one as well. Well done.